This video is now in session, and today let's talk about the CDC. Let's talk about the FDA and the Biden's administration. The COVID-19 pandemic has showed how important communication is. Ever since the beginning of this pandemic, we have seen a trend happen where health experts have not properly and succinctly communicated with the world population on what is happening with COVID-19, how transmissible it is, how safe vaccines are, how do vaccines work, and general guidelines that people should follow. Most people genuinely want to follow the science. They want to follow what is truthful advice. But the thing is, the FDA, the CDC, they have screwed up on their communications. And it has started with the beginning of the pandemic. So at the beginning, we saw Anthony Fauci make his presence known by giving interviews, by giving briefings, and he became the de facto communicator for the COVID-19 pandemic. And then we saw Donald Trump come. So Donald Trump came, and essentially he wanted to go off of a calm down approach. Calm down, and we got this. Except the problem was that COVID-19 cases were rising in the United States. If we look at COVID-19 here, they were at a high of 32,000, 33,000 cases. And that really, I guess, contradicted what Donald Trump said. So then he and Fauci started becoming the communicators, both him and Fauci, not just Fauci anymore, but also Donald Trump. But because you had a contradiction, an implicit contradiction between the two people, you had contrasting guidance, one from Trump and one from Fauci, and it started to become political because Trump is a Republican. So because of that, Democrats started flocking over to Fauci's advice, and Republicans started flocking to Trump's advice. And those are two different people with two different visions of this pandemic. So you saw a disconnect happen there, and then you saw slowly but surely a lot of Americans starting to distrust the FDA, the CDC, and Anthony Fauci because Donald Trump was saying something different from those organizations. So that happens, and then the 2020 election happens. So the 2020 election happens, and Joe Biden is elected. But you still have those same divides as before. You have people who no longer have Trump, but can still reject Fauci, the CDC, and the FDA, and at this point now Biden. So with that, there's been really a confusion over what has been happening, and part of that rejection is because of that confusion that the CDC, the FDA, and politics has created. Because when you have two contrasting views, then you have people who don't really know what to believe in. And if you have people who don't know what to believe in, then that starts to create a dangerous scenario where people believe in the wrong things, mistakenly believe in the wrong things, and dig themselves a rabbit hole into a pile of lies. So that's essentially what's been happening, and this latest iteration is now the booster shot. The booster shot, initially, Biden said it should be offered to everyone after 8 months of vaccination, but the FDA and the CDC, they were not ready to confirm that. They were not ready to go through with that, which is why you saw a rejection by the FDA for booster shots that for most people under 65 years old. And then you also saw, I guess, a rejection of the CDC and part of that. And then from there, the leader of the CDC, the head of the CDC, then says that, no, I'm rejecting the CDC advisor's guidance and saying that you should get the booster shot if you have certain risks, including if you have a job. So this disconnect between the CDC within itself, this kind of micro divide, and then a more macro divide between the CDC and the FDA, as well as the Biden administration, creates so many different kinds of guidances that Americans in general are just confused. They're confused as to what they need to do, and they're confused at what is scientific evidence and what is politics. So because of that, now people are confused, and now the FDA and the CDC, instead of spending time on figuring out if booster shots are effective for younger Americans, especially for Moderna and J&J shots, now they're trying to focus on on hammering down the right guidance for Americans. A lot of people right now don't know if they should get a booster shot or not, if they are eligible or not. So in terms of eligibility, so far it's around it's only applies for the Pfizer shot, and it's after 8 months you got your second vaccine. If you're an elder, if you're an elder, like, or senior, if you're over 65, then you can get the booster shot. If you have diabetes, if you're a frontline worker, if your job is high risk in terms of transmission, you should get the shot as well. That's basically the guidance that the guidance that should be given. But there's such a disconnect between the CDC within itself and then the FDA and Biden, to the point where not everyone is going to know that information. And that is something that takes time to correct. And it's something that we have to learn from, because there will be more pandemics. There will be more health crises. And to deal with them, we need succinct communication, and we also need humility from those organizations. If we're talking about humility, we're talking about saying that the COVID-19 is something new. It's something that we're still kind of investigating on, and there will be situations where we have different information to give, where we have new guidance. So just bear with us. And then be conservative on what you release, on what you talk about. Be conservative on the press releases that you give, because essentially if you give the wrong information, or if your information is eventually overturned, then you are going to create confusion, and that is not good for the general public, and it's also not good for public health safety. But again, the first part of humility is important. Having Americans acknowledge that the CDC and the FDA's response will be an experiment is useful to figuring out what exactly is the best method. You could use the analogy of like the Fed. The Fed right now, a lot of people don't like the Fed because of how because of its actions, but you have to respect that they are trying their best to kind of create the best scenario for their experiment, because they are conducting experiments, since they honestly, and no one honestly knows how the economy is going to function and react. So they acknowledge that they're not going to be right a lot of the times, but that ultimately they're going to try to keep experimenting and going for the best thing possible. And that's what Jerome Powell has been saying and has been doing. So that's the kind of message that the CDC and the FDA need in their COVID-19 response. It's to be it's to have some humility about it and say that we might be wrong sometimes, but that ultimately we will do our best to give the most factual, scientific evidence based on the best data available. And if the FDA, if those institutions say that, and if they said that early in the pandemic, then a lot of Americans would be willing to follow the advice of the CDC and the FDA, because they recognize that they're simply trying to do the best thing possible, and that they recognize that the FDA and the CDC are genuine institutions trying to help Americans. But it's too late for that now, because it's been at this point well over a year, 1.5 years at this point since the COVID-19 pandemic began. And it's not really functioning that well, at least our response to it. You can see that vaccinations are increasing overall, but that It's still not at the herd immunity rate. If the United States really wants something effective, especially now with the news about the Pfizer vaccines not being as effective a couple of months in, then they need around 80% of a vaccination rate, maybe even 85%. But they're nowhere near that, and as a result, it's very hard for them to get to that point, especially because now the COVID pandemic, the COVID-19, COVID-19 is going down in the United States. You can see it's going down, and that directly corresponds with who gets the shot and who doesn't get the shot. You can see there has been a decrease in the amount of people getting a shot, especially after Labor Day, because you can see that COVID cases are going down. At this point, we're seeing a correlation between COVID-19 cases and COVID-19 vaccination, and because less people are getting vaccinated, that means that more people that there will be, I guess, a stagnation of progress for the the response to this virus, and that ultimately it just continues to compound the problem that we face today. So that's the end of this video. Hope you enjoyed it. This video is now adjourned, and I'll see you in the next one.